Welcome. I'm Scott Slade at the WSB Live Lounge. I'm the host of Atlanta's Morning News on 95.5 FM and AM 750 WSB. And I'm honored today to tackle a problem that has been making headlines and seemingly has no solution. The good news is it does. The real focus in the news lately has been the opioid epidemic. But that's a symptom of a larger problem, prescription abuse. And that's one of the things we're going to try to get to today in this discussion with our terrific panel today. I'd like to introduce them to you now. Joining us is Donna Dent. She's the Assistant Director of the Office of Behavioral Health Prevention. Welcome, Donna.
Thank you very much.
Dr. Liza Chapman is with us, President of the Georgia Pharmacy Association and Clinical Sales Manager at Kroger. It's great to have you.
Good morning.
And Dr. Susan Blank is an addiction psychiatrist and clinical co-chair of Think About It, the initiative that's under the umbrella of the Medical Association of Georgia and the MAG Foundation. Welcome.
Thank you.
Donna, how do you see the problem? I mean, we didn't get here overnight, did we?
No, we didn't. It's been a long time coming, and one of the things that has led to this has been a relaxation and a sense of prescribing, having a lot of access to prescription drugs, as well as some of the issues around enforcement. So you have the issue of a lot of youth and a lot of older people who have a lot of drugs that are not disposing of them properly, and then people either beginning to use them improperly or people as well starting to try to self-diagnose and self-medicate and then getting into trouble.
Susan, from the addiction side of things,
Right.
there are some people who are more physically disposed
Correct.
to developing an addiction. Speak to that and how you might be able to break that chain.
Well, I think that certainly not everyone who gets into trouble with prescription medications has the disease of addiction. But we do know that probably at least 2 million people in the United States have the genetic predisposition towards the disease of addiction. And as they begin to use drugs, the way those drugs affect their brain is different than it does earth people, as we call people who don't have addiction. What happens when they take an opiate is that rather than getting some pain relief, they actually get euphoric. They feel energy, they feel motivation, they feel like they're better than they were without the drug. And indeed, in the beginning, they probably are. So it's a different way in which their brain is wired from the time they were children. Nora Volkow from the National Institute of Drug Abuse talks about addiction as being a childhood brain disease. So these folks from the beginning are wired differently, they're going to react differently, and they're going to get into trouble. But all of us can have problems taking these medications. And so while of course my work is focusing on those folks who have gotten into serious trouble, other people can have problems too in the way that they take the medicines or their misunderstanding about them. So addiction is a big part of it, but it's not the only thing. And that's where I think our audience really needs to understand that. We all have a potential to get into trouble with these medicines, even if we're not genetically predisposed.
Talk about self-prescribing. And maybe your wife, let's say, had a sinus infection and she didn't finish all of her antibiotics, and you're feeling a little, I may be developing something, it's probably an allergy. I think I'll take a couple of antibiotics to see if I feel better. What's the danger in that?
Patients should not be self-prescribing, and they should not be self-medicating with someone else's medication. They should contact their physician or mid-level practitioner, nurse practitioner, physician assistant to actually have a diagnosis before they take any medication, because there may be allergies, it may be interactions with other medications that they're currently taking or other conditions that they have. Oh, yeah. So it's not a one-size-fits-all of what's in that prescription bottle.
Walk us through how a typical person, let's say a homeowner, would do a self-audit. What should we be looking for, and how should we get our homes safer?
Anything that has an expiration date that has already been met or set, that is a good sign to go ahead and get rid of that prescription or over-the-counter medication as well. So, set a schedule. quarterly or every 6 months to make sure that you clean out your medicine cabinet.
The other thing you can do is we have some national take-back days. We have one coming up October 28th, where there will be different places throughout the community where you can take your drugs and give them to the take-back day to get rid of.
That's better than flushing them down the toilet.
Yes.
Absolutely.
Please
Do
don't.
not do that to our environment.
Please don't.
Because it gets into our water system, all of those medications that way. You really want to try to dispose of them. If you're going to dispose of them, you probably could take them back to your pharmacist. You can crush them up and dispose of them in a way that nobody else can then reuse them. That's the primary goal.
In several of the surrounding counties of Metro Atlanta, law enforcement have take-back boxes, so you don't necessarily have to wait for a specific take-back day.
Yes.
Tell me about the Georgia Crisis and Access Line. How does that work?
It's a 24-hour, 7-day-a-week crisis line. Anyone can call in and get assistance on the phone with substance abuse issues, mental health issues, anything from someone who they think may be, or if they themselves are feeling suicidal, or any kind of mental health issues, they can call and get immediate direction for resources. They may also be able to put them directly in touch with a crisis mobile unit, which can actually even come out to you if you're in a location where you can't get someplace. So it's a great line, a great resource for people to call into if they're having any problems.
You know, that's a powerful message. I would bet people with addictions feel very lonely.
They do.
That they feel like I'm the only one that's ever been through this. Nobody can help me. And that's not true.
It is certainly not true.
And once again, I'm Scott Slade. Thank you for joining us today. Our terrific panel trying to get to the root of the problem of prescription drug abuse and giving you some real tools on what to do about it. The Georgia Crisis Line, the number is available on your screen. The Think About It program will make that resource available to you as well. Use them. Talk to the people who know you best in the health provider community. And thanks again for joining us today. We hope we gave you something that will help. Be healthy.